Good morning, everyone. I'm Dr. AMEENA AKHLAQ from AIOCMTC1, and I'll be presenting my paper on the role of Pentacam in studying the effects of laser peripheral iridotomy on the anterior chamber in synechial angle closure. I have nil financial interest. So as we know that glaucoma is the leading cause of irreversible blindness worldwide, and primary angle closure glaucoma is an aggressive and visually destructive disease with estimations that it blinds 5 times more people than primary open angle glaucoma. Unfortunately, the predictive value of gonioscopy is relatively poor in determining which susceptible eyes will develop overt angle closure, even when experienced clinicians perform gonioscopy. Hence, we need devices that can objectively measure these parameters. So Pentacam is one such device that is a comprehensive anterior chamber analyzer, and it has a 3-dimensional rotating Schempflug camera that non-invasively acquires cross-sectional images to quantify the anterior segment of the eye. So the present study was conducted to compare the effects of LPI in synechial angle closure in its 2 stages, that is the primary angle closure PAC and primary angle closure glaucoma, on the anatomical and clinical parameters. The quantitative changes in the parameters were to be assessed by the changes in the anterior chamber depth, both central anterior chamber depth CACD and the peripheral anterior chamber depth PACD, and the anterior chamber volume as measured by Pentacam. The clinical changes to be assessed by the changes in the intraocular pressure, and the anatomical parameters by the changes in the gonioscopy pre-LPI and post-LPI as per the Schaffer's grade. So we included all the patients presenting in the glaucoma department and divided them into 2 groups, Group A PAC and Group B PACG. PAC was defined when there was more than 270 degrees of iridotrabecular contract and raised intraocular pressure and or the presence of peripheral anterior synechiae. And PACG was the presence of PAC with glaucomatous optic neuropathy and corresponding visual field effects. The patients were studied for 1 year. It was a prospective observational study, and the sample size was 160 eyes, 80 each from PAC and PACG respectively. The patient underwent an in-depth ocular examination including visual acuity slit lamp, IOP by Goldman's applanation tonometer, gonioscopy with a Sussman 4-mirror lens, and all the eligible eyes underwent anterior segment imaging using Pentacam before LPI and at 1 week and 1 month follow-up. So we included patients diagnosed with PAC or PACG with age more than 40 years and willing to sign the consent form and comply with the post-procedure follow-up schedule, and the patients unwilling to participate in the study, secondary glaucomas, and any other ocular abnormality other than glaucoma, including history of cataract surgery or open angle glaucomas, were excluded from the study. So we observed that from a total of 160 eyes, 107 were females and 53 were males, and majority of the patients that underwent LPI in both the eyes. So these are the results showing that in the PAC group, when we compared the pre-LPI and the week 1 findings, the anterior chamber angle improved, the Schaffer's grade improved in all the 4 angles with p-values less than 0.05. This finding was seen at both 1 week and 1 month. Now in the PACG group, similar findings were noted that the Schaffer's grade improved, but the improvement was less as compared to the PAC group due to the presence of synechiae. This is the image of the Oculus Pentacam used in a study. The 25 image acquisition protocol was used, which automatically calculates the anterior chamber volume and the central anterior chamber depth, and we calculated the peripheral anterior chamber depth in a 9mm circle in relation to the center of the pupil at 12 o'clock, 3 o'clock, 6 o'clock, and 9 o'clock. So the values, this is a tabular form showing the values, which shows that in the PAC group, both at 1 week and 1 month, all the values CACD and the peripheral anterior chamber depth and the anterior chamber volume improved dramatically with p-values less than 0.05, which was significant. But while in the PACG group, the IOP reduction was significant, but the PACD at 9 o'clock, that was only significant. Other values improved, but it was not significant. So as we know that the number of people affected worldwide with glaucoma by 2010 was 40%, mainly in Asia, with more than 75% being angle closure patients. And to effectively prevent PACG by using PI, it is necessary to identify people with narrow angles. So we found out that laser peripheral iridotomy causes significant changes in the indices of anterior chamber, which can now be documented objectively with the help of Pentacam. And we studied only eyes with synechial angle closure and found similar results as previous studies, that the improvement in the AC parameters was more in PAC as compared to PACG, and therefore we conclude that Pentacam is an excellent non-invasive tool for measuring and quantifying changes in anterior chamber following laser PI, and hopefully in the light of observations made in our study and previous studies, Pentacam may holistically be used in glaucoma diagnostics primarily. and in the best of our knowledge, there has been no other study conducted which assesses the role of pentacam in evaluating the effects of LPI. These are my references. Thank you.